I'm Dr. Ty Vincent, a little LDI topic, but also general pediatrics sort of topic, maybe some adults. So we're talking about strep throat, okay? If you have, or someone in your house has recurring strep throat, right? They keep getting strep, they get the sore throat, the fever, or maybe they don't. Maybe you have a kid or you yourself have unusual symptoms. Maybe you just start to get a weird rash, or maybe you start to get stomach pain or nausea or lose your appetite or get weird psychiatric manifestations. Like there's a condition called PANDAS, which is pediatric autoimmune neuropsychiatric disorder associated with streptococcus. It's a mouthful. But some people, pediatric in this case, but adults can manifest the same thing. When they have streptococcus colonizing their throat, their immune system will react to it in such a way that they get this particular kind of brain inflammation where they become kind of psychotic almost. They have OCD manifestations and anger and rage. So they're not really delusional, they're not really psychotic, but some of the kids will seem just completely off the wall, out of control. And it's really hard to deal with. That one, is the weird brain inflammation, autoimmunity. The classic reaction people have to strep is to have swollen, pus-covered tonsils that are red and painful. It hurts to swallow. You get a fever. You feel horrible, have no energy, and you feel just terrible. You might get a lot of nausea, stomach aches, things like that. Those are the typical. You could end up with a rash, like a fine sandpaper kind of mildly red rash. They call the Scarlatina rash. Your tongue can get this kind of general whiteness to it with red dots all over it that they call a strawberry tongue. Kind of looks like strawberry. Or maybe the opposite. Maybe it's mostly pink and red with white dots. Anyway, it'll look like a weird strawberry or a photo negative of a strawberry. These are all things you can see with strep. If you do have someone who keeps getting strep, if there are multiple people in the house that keep getting strep over and over again, test the one kid who doesn't get it, or the adult, mom or dad, or one of the kids who never seems to get sick. Test that person because they're usually a carrier. About 10% of the population can carry strep pyogenes, the specific organism that causes strep throat and all these autoimmune syndromes, with no symptoms, just a carrier, right? So you're carrying it, you're inoculated, it's part of your ecosystem, but you're not sick. And so you, that 1/10 of the population, manage to spread it to everybody else all the time. So if you have a household where this is going on, make sure you get a throat culture on the person who doesn't get sick, not the rapid strep test, okay? The rapid strep test will often be negative in these people because they don't have heavy growth of the organism. They're carrying it at a normal kind of low level. So you have to do the culture and make sure that they don't have it based on those results. That's much more specific and sensitive, okay? And then you can give that person antibiotics for 10 days, eradicate it, and maybe everybody else in the house stops getting sick until that carrier picks it up from the environment again sometime, which they probably will. It happens. If you have somebody who just keeps getting strep throat, they're getting exposed in the population at school or whatever, and there isn't a carrier in the house, LDI, low dose immunotherapy, actually works really well. We have a mixture of streptococcus species that includes that one and some relatives that live in the throat and mouth as well. And we can give that to people and they will stop manifesting the illness. It's fascinating. They just won't get sick. It works for kids with the PANDAS manifestation. It works for people with guttate psoriasis. So there's a form of psoriasis that's caused by an immune reaction to strep that looks like you were splattered with the stuff. So instead of big plaques with all these large flakes, they have little pink, like with fine scale, little pink dots and splotches of psoriasis rash that kind of splatter all over the place. A lot of times kids will get it on their face for some reason, like little pink salmon colored maybe patches that are kind of flat. They're not that severe looking, they're milder, but they'll be all over the place. They might be itchy. So if you get the guttate psoriasis people, or you have the PANDAS kids, or you have people with recurring strep throat, there are some of these reasons why the strep LDI can be very useful. And now you know more about strep than you ever wanted to know. Thanks.